Hello, I'm Dr. Terry Simpson for YourDoctorsOrders.com. This week's New England Journal of Medical Center was an editorial written by Dr. Julie Cantor, who is a physician and a lawyer practicing in Los Angeles, where she relates a case of Samantha Burton, a 25-week pregnant female whose membranes ruptured, which means that she was in danger of losing the fetus, and was admitted to Tallahassee Medical Center by her obstetrician-prescribed bed rest. When this mother of two at home decided bed rest wasn't in her best interest and leave, she was physically blocked from leaving. She was then brought before a court. Was brought in, where they heard arguments from the hospital state attorney and from the obstetrician, who is now considered the unborn child's attending physician. Mrs. Burton testified by phone, but had neither an attorney, nor an expert, nor a physician of her own to testify on her behalf. The following day, the judge ruled the Tallahassee Medical Center and their providers could administer any care to preserve the fetus' life and health, and ordered Burton to comply. Sadly, several days later, the fetus had died. The patient went home and went into labor and was brought back forcibly to the hospital, where she underwent a C-section, even though she was in labor and probably would have delivered normally. If you ever wondered about Big Brother, this case sums it up in a number of issues and presents ethical issues for physicians. The court took away this woman's right to care and her own body and subject her to the needs of a fetus. The court essentially said, you will be a forced incubator at our will. For a physician, this means that the patient came to that physician and that physician abandoned the patient in favor of the fetus. We physicians have an ethical obligation not to abandon our patients without transferring the care to another physician. They did not do this. The court didn't grant this woman or others who have who have been brought before courts in a similar manner the ability to have their own experts, legal counsel at these administrative hearings, and essentially made them a prisoner incarcerated at a hospital without Sixth Amendment rights to having their own attorney. I can't abandon a patient, but apparently I can if I were an OB-GYN living in Tallahassee, Florida, where I can not only instantly abandon the patient, but have her brought back to a hospital and perform surgical procedures, feeling that I am under the penumbra of a court. This forced intervention of medical care should be unique, rare, and should not pit the needs of one patient against another person. In the article, Dr. Cantor relates that this could open the door to where parents should be giving their kidneys to children. This is more than a slippery slope. This is an avalanche. In my opinion, the OB-GYN physicians who abandoned Ms. Burton should be stripped of their medical licenses for unethical behavior. Not only do they operate under the veil of court protection, which is not medical ethics, so that they could avoid their own ethics, they operated on her, not to save the life of the fetus, which was dead at this point, and not for any reason that anybody who reviewed the case could understand. Forced surgery, forced incarceration is not what modern medical ethics are made of. In fact, it's one of the reasons we fought Nazi Germany and Joseph Mengele and all those horrible experimentations. I'm sure you'll have a comment about this on YourDoctorsOrders.com. I'm Dr. Terry Simpson. Good day.